Hello, hi, it's Dr. Erica. Thank you for joining me again on this live video chat. I'm going to talk about seizure medications. I've uploaded some videos, so please see those more previous ones learning the seizure awareness, epilepsy awareness, also medication. It's a new medication, SEZABY, which is a liquid IV medication for use in neonates. The generic or ingredient is phenobarbital, which comes in tablet form and can be used for sedation as well as convulsion. So that's why it is newly being FDA approved for use in neonates as a preservative-free product. Previously, it has been used, but this particular one that's FDA approved that you may hear about is preservative-free, which is safer and more secure for neonates and newborns. So it is a 100 milligram vial, 10 milligrams per 1 milliliter, and it is IV, and when reconstituted, it is also very safe and effective, and again, only indicated for the neonates. It has been used off-label for adults and also geriatrics. However, we want to stick with the research, stick with the actual analysis and the results, the endpoints that say that we should use it as indicated, okay? Now, it has a large drug interaction, meaning that there's numerous other medications that it interact with, such as alcohol in the body, valproic acid, also anticoagulants, beta blockers, estrogens, antibiotics, antifungals, also medications for corticosteroids. So do be aware of the side effect profile. There are some psychological and physiological dependence with this particular medication. Again, it's going to help with sedation, with calming the CNS system, the central nervous system. Also, it's going to help with drowsiness, help with convulsions. It's category pregnancy D, so we don't recommend it in pregnancy at this point unless the benefit really outweighs the risk. Lightheadedness and residual sedation are other side effects that patients may experience. Again, it can be habit forming. That's a large warning with this particular medication. Habit forming meaning that it causes a dependence. And the patient may not even know they're dependent on it because they've been on it for a long period of time. But usually that is one of the larger side effects is dependence, okay? Now, if a dose is missed, take it as soon as possible. If it's too close to the next dose, forget about that dose and go ahead and continue with the regular schedule so that we're not doubling up on medication. Okay, patients with liver impairment, renal impairment should use caution and dosing adjustments as well. It does interact with the cytochrome P450 enzyme system, so do be aware of that. It works along the pathway of the GABA pathway. So that's good to know because we want to optimize therapy when we're treating our seizure patients. Optimizing therapy produces better outcomes for the patient, produces seizure-free long-term periods as well, and better overall control of their seizure and of their medication regimen. So we do want to make sure we understand mechanism of action. We want to not only mechanism of action, but also the pathway along the brain cranium, as well as side effect profile, drug-drug interaction profile, possible off-label indications, official indications. We want to make sure we understand seizure medications fully and completely so that our patient will receive the best health care from their team of healthcare providers. So we do want to make sure that we are aware of that. So phenobarbital, again, is a medication, comes in tablet forms. It comes in elixir form as well as IV for use for our neonates as well, and it's called SEZABY or SEZABY. And again, it's indicated only for our neonates. And it is on the market, newly approved, preservative-free, no alcohol preservatives, which is good, and also which lessens the side effect. It is a high contraindication against hypersensitivity, contraindication against other medications that may build blood toxicity. So if there's any type of situation where that is the case, you don't want to use phenobarbital. Also, the new medication that has just been FDA approved, SEZABY, we do not want to use it in that population because there is a true contraindication for those two reasons. I do want to go over LAMICTAL. LAMICTAL is also a sedative or anticonvulsant medication. Lamotrigine is the brand name, and it comes in chewable tablets. It also comes in doses that are much higher, and it usually is for adjunctive therapy with other medications. Pediatric and adult patients can use this in addition to their normal medications. For partial seizure, remember, partial seizure is where there's just a sporadic neuron firing in the brain, one particular location. And then it's also indicated for generalized seizure, where there's constant firing along all lobes of the brain, affecting the total body, can lead to convulsions, can lead to tonic-clonic seizure. So do be aware of that. Also, this medication can be dosed at 25 milligrams to 200 milligrams once a day, which is good. That is comparable to other anticonvulsant medication. This particular one is dosed very low, up to 200 milligrams one time a day, which is very convenient. There are some adjustments in patients who have who are children and adults. There are different dosings for those particular patients. And it comes in immediate release and extended release as well. I do recommend it compared to the other seizure medications. It is highly effective, and one of the newer generation. It's a newer generation anticonvulsant, meaning that it hasn't been on the market as long as phenobarbital or valproic acid or Depakote, all of those. This particular one may cause dizziness, may cause somnolence as well, headache, also blurred vision, nausea, vomiting, and rash. Now, the chewable tablets may be chewed or dispersed in water or diluted with a type of fruit juice to help with consumption and also with taste as well. It does have a large drug-drug interaction of valproic acid, also oral contraceptives, estrogen, progesterone, for example. It's serious life-threatening rashes have been reported with LAMICTAL, so do be aware that rashes usually occur, it says, within first 2 weeks of therapy and more for pediatric patients. So within the first 2 to 4 weeks, make sure our pediatric patients are being monitored for rash. And also in patients who are taking valproic acid, they may experience a rash as well. Hypersensitivity is very serious, and so there may be an adjustment or an alternative in its place. Also, with long-term use, there may be changes with the ophthalmic, with the eyes. So there might be testing that may need to be done or performed. Also, there may be melanin-containing tissues. It usually binds to those tissues and may cause toxicity with long-term use. So do be aware of that. And again, it is safe in pregnancy. It's category C, which says the patient can take the medication. There's no research that says that the patient can't or they can. So do use accordingly as physicians prescribe. So this particular medication is safer than most other seizure medications, besides the serious hypersensitivity or rash sensation, and also the effect on the eyes, and also its binding effect to melanin. And so we do want to be aware of that, and also its drug-drug interaction. Now, its mechanism of action is really unknown, but it says that it affects serotonin, dopamine, histamine, opioid, muscarinic receptors, GABA, also A1 and A2 receptors. It may be due to its actual mechanism may be due to an inhibition of voltage sensitivity sodium channels, okay, resulting in stabilization and modulation of transmitter release of the glutamate and aspartate. Okay, after an oral dose, the half-life is usually 2 to 5 hours, depending on the anti-epileptic drug therapy, and it's eliminated after about 12 to 14 hours. So it's after 12 to 14 hours. So that's usually why it's dosed once a day, to ensure that the plasma level is at an effective amount. Okay. So this particular medication, LAMICTAL, again, is very safe. I recommend it in children as early as 2 years of age, it says, who are taking valproic acid, and also those adults as well who are also taking valproic acid. So this medication, again, it works by stabilizing cell membrane of glutamate and aspartate as well. It does affect GABA. It also affects opioids as well. So if you're taking opioid therapy, do be cautious about the intense side effect of drowsiness and sedation, respiratory relaxation as well. So do be aware of those side effects, okay? Because it's acting differently in different pathways, not only CNS, but it's acting on histamine channels as well. So they're, again, maybe causing rash. That's where that is going to come from, because it's going to act on the histamine receptor. So do be aware of that. It works with dopamine. So it makes dopamine is a neurotransmitter that is a pleasurable neurotransmitter that lets us know that we're experiencing pleasure, and we're experiencing a type of euphoria. So do be aware of that as well. And it affects serotonin. Serotonin has to do with headaches. Serotonin has to do with, it's a neurotransmitter as well. So it has to do with a lot of different things, especially the mood, and also headache as well, because it works in the CNS system, central nervous system. Okay, so this particular medication, I would give my advice to go ahead and take it with valproic acid if needed for increased stability and increased control for freedom from seizure. Again, the doctor will evaluate the patient for those reasons before actually giving this medication a trial for each patient. And again, it comes in extended release for once a day dosing, and also it comes in chewable tablet as well for those who may not be able to consume the tablet completely and wholly. And I do recommend it overall. So do be aware of the side effects as well. There's other seizure medications that are on the market. Some are better than others. Some have been newly revised. Some are still like first choice, first generation that are being used. So I do think that healthcare teams are doing their due diligence to ensure that patients are safe. Also see my video on seizure epilepsy awareness, where I talk about post-seizure, pre-seizure, and during seizure treatment. Also, I have a video on fluid requirements. Fluid requirements are very important after seizures. Also, there are treatments to help with patient recovery, to help with better control, help avoid triggers. Please see those videos as well. They're very important. Okay. Now, if you have any questions or comments, please let me know. I'm Dr. Erica, pharmacist. Please leave any comments, questions you may have, topic suggestions. Please like, please share, and please subscribe. Also, thank you for joining me, and I hope to see you on the next video. Goodbye.